What does retinol do to your skin exactly? Well, hey guys, retinol is a super popular skincare ingredient. You can't go online into any sort of skincare space without getting hit in the face with retinol this, retinol that. I honestly think a lot of people are sort of getting sick of hearing all about retinol all the time, and hyperbolic language like you must use a retinol in your skincare routine. I really think people are starting to side-eye that, question it. At any rate, state, is it overhyped? What exactly does it do? Retinoids are a class of vitamin A derivatives or analogs that can be taken by mouth or applied to the skin to affect change in various skin disorders, skin conditions, skin symptoms, and the overall appearance of the skin. For today's video, we are only going to be discussing what retinol does when you apply it to your skin. And for brevity's sake, I'm just going to use the term retinol as an umbrella term for these vitamin A derivatives that you apply to your skin. That's going to include the prescription medications as well as the over-the-counter non-drug cosmetics. So vitamin A, it is super important for normal maturation of your skin cells, and it plays vital functions in a variety of processes. It's so important for our health that if you are low in vitamin A, as a matter of fact, check out my video on signs you are low, deficient in vitamin A. You'll have your eyes open to all of the wonderful things it does. Normally we get vitamin A from our diet, and it is stored in our liver, and it makes its way to various tissues throughout our body by circulating in our blood on a little vessel known as retinol binding protein. It makes its way just below the epidermis. It's taken up by the bottom layer cells of the epidermis. Those are called basal keratinocytes. The epidermis is the top layer of the skin, and think of it as a multi-storied apartment complex where skin cells reside at different levels depending on their maturation. At the very bottom, you have the basal keratinocytes, and then as they mature, they make their way up to the top, the roof, and at that point, they are fully matured, no longer even a cell, just a cell remnant called a corneocyte that is part of the protective barrier. So as those basal keratinocytes that have taken up the vitamin A from the blood, as they divide, they pass the vitamin A up through the epidermis so that it is distributed throughout your epidermis. Think of this as an inside-out process. However, when we're talking about applying vitamin A to the skin, it is an outside-in process. When retinol is applied to the skin, it's taken up by keratinocytes and it diffuses throughout the epidermis. It's actually taken up inside the keratinocytes. Those are the skin cells. It doesn't just float around randomly. It is actively taken up into those cells. Once it's inside the cell, it is escorted to the nucleus. The nucleus is the part of the cell that stores basically the blueprints, the genetic material, the blueprints, if you will, for how a given cell should behave. And various things can influence what blueprints are controlling things, namely something called transcription factors. Retinol, once they make their way to the nucleus, they bind to certain receptors and they influence what blueprints get expressed so as to influence how cells behave. Topically applied retinol penetrates all the way throughout the epidermis to the bottom layer of the epidermis, down in the basement of it, if you will, to the basal layer. And it can also penetrate down into the dermis, which is below the epidermis, as well as the subcutis, which is below the dermis and has things like fat. That's what happens when you put retinol on your skin. One of the more evident ways in which retinol influences keratinocyte cell biology, those are the cells, again, that make up skin's epidermis, is it actually helps cut down on the interconnections between neighboring keratinocytes so that they loosen and exfoliate better. This is especially important for acne, where one of the main issues going on with acne is that those skin cells that are trying to shed, they're stuck together inside the pore, and that's what leads to plugging of the pore and comedone formation. A comedone is a blackhead or a whitehead. With age, with certain skin disorders, and with dry skin, that normal exfoliation process slows down. This leads to flakes, scales, rough skin texture, dry bumps. Furthermore, retinol enhances epidermal cell turnover. It accelerates the number of divisions that the cells at the bottom layer, the basal layer, undergo, so that they make their way to the top part, the stratum corneum. Basically, it gets things moving and maturation on track in a more efficient manner in your epidermis. The increase in skin cell turnover, it may sound alarming, like, oh my gosh, if it increases cell turnover, won't we eventually run out of skin? Won't it age us more rapidly? No. The good news is when it comes to skin biology is that down in the basal layer of the epidermis, as well as within the hair follicles, you have stem cells, which ensure that your skin will be able to regenerate throughout your lifetime. Now, the improved maturation of the epidermis coupled with better exfoliation of skin's outermost layer, those outcomes of retinol improve skin's vital functions of acting as a barrier, protecting you from external aggressors, microbes, pathogens, but also make it better at keeping hydration in. So basically allows it to do its job better. Because of this, retinol actually in the long run can make your skin less irritable to things that come in contact with it. Now, cosmetically, people will appreciate these outcomes of retinol in that their skin is a lot smoother, clearer, they have an improvement in skin texture. Again, if you have rough and bumpy skin, that starts to improve as well. Now, one of the joys of getting wiser, of getting older, if you will, is that with age, the top part of the skin, the epidermis, it atrophies, it thins. Part of this is related to cumulative sun exposure throughout our lifetime. You see, UV rays from the sun, they damage the blueprints in those skin cells. They cause DNA damage, those UV rays. So that, coupled with just natural processes starting to decline as part of aging, you get atrophy of the epidermis. And along with that comes a decline in barrier function. With age, the skin cells, they do not turn over efficiently. And because they are damaged either from sun exposure or just damage that accumulates from other environmental aggressors, they don't always look normal. They're sometimes kind of oriented abnormally. Some of them have DNA damage such that they might set the stage for skin cancer. Using a topical retinol actually by virtue of the fact that it improves maturation, it makes those cells start to look and act and behave more appropriately. So it can reverse sun damage. So for people who have extensive sun damage, topical retinol actually can cut down on the number of pre-skin cancers that they form. Skincare ingredients and medications, they have an easier time getting into skin that has been smoothed out by retinol because they don't have to cross those mounds, those heaps of dry, stuck together skin cells. Now, if you will recall from my video all about chemical peels, a lot of dermatologists will prescribe a retinol for their patients to apply several weeks in advance of getting a chemical peel because it will allow the chemical peel ingredients to get into the skin more efficiently, without having to traverse those mounds of dry, stuck together skin cells. We also use topical retinol to enhance the penetration of medications. For example, topical retinol to the scalp can enhance the penetration of the hair loss treatment minoxidil. Because retinol helps to improve the efficiency of skin cell turnover in the epidermis, it also helps to hasten clearance of discoloration, of hyperpigmentation, age spots, sunspots, post-inflammatory hyperpigmentation, even components of melasma. Basically, those keratinocytes in the epidermis, they can be stuffed with pigment and basically are stained. And so the retinol helps get rid of those, clean them out. Now, up until this point in our discussion on retinol's impact on the epidermis, we've mostly focused on what it does to keratinocytes. Those are the main cell type of your epidermis. But down in the basement, in the basal layer, you also have a cell type called the melanocyte, which is what makes pigment. And retinol can act on the melanocytes to suppress the pigment-producing enzyme within the melanocyte, which is called tyrosinase. Ultimately, that helps to cut down on excessive pigment production. Those melanocytes that get stimulated to make pigment by various and sundry insults like ultraviolet radiation, environmental aggressors, irritation, hormones. Retinol also tames the melanocytes' desire, if you will, to transfer pigment to the keratinocytes. Again, because retinol smooths out the skin surface, it allows for better penetration of other drugs, medications that might be used to clear up hyperpigmentation like hydroquinone, glycolic acid, topical steroids, azelaic acid. In fact, when these medications are used alongside a retinol, the results are often significantly better than when the ingredients are used without retinol. Retinol will also cause dispersion of melanin granules, pigment granules in the skin, and through light scattering that makes the overall skin tone appear a lot brighter. So not only do you have a smooth surface for the light to scatter off of, but you also have more dispersion of that pigment, so ultimately everything looks a lot clearer and brighter. It has a skin brightening effect. Topical retinol also goes to work controlling blueprints such that it leads to a reduction in certain markers of inflammation, certain inflammatory processes. And this is highly, highly beneficial in the treatment of a variety of inflammatory skin conditions like acne, rosacea even though it's popular myth that people with rosacea cannot use retinol. That's not true. Retinol actually can help people with rosacea quite a bit. Also, part of how it can be helpful for hyperpigmentation and melasma, because inflammation in the skin drives discoloration and stubborn pigment production. Retinol not only reverses the epidermal atrophy that occurs with age, in other words, it thickens the epidermis, but if you take a biopsy of someone's skin who has been using retinol for a long period of time and you look at one of the layers, one of the floors in the apartment of the epidermis, if you will, what you will see is you'll take a look at what's called the granular layer. That is right below the outermost protective shell, the stratum corneum. The granular layer looks granular because those cells there, they basically secrete the lipids that go into the stratum corneum. You see, when we describe the stratum corneum, the skin barrier, we talk about this brick and mortar model, where the bricks are those little shells of former cells called corneocytes, and they are enmeshed in this lipid matrix. Well, the cells right below the stratum corneum, they are pumping lipid out into the stratum corneum to make the cement, basically the mortar between the bricks. And what happens with age is that starts to decline, so you have a decline in barrier function. Topical retinol can improve the number of those cells doing lipid production, and it also can stimulate the production of water-retaining compounds, hygroscopics, natural moisturizing factors. Water retention in skin's outermost layer is key. It's key for the natural exfoliation processes to ensue, because the enzymes that dictate exfoliation in your skin naturally, they rely on water. It's also important for the overall appearance of the skin. When the skin is hydrated, skin cells are plump, smooth, everything looks more radiant. When water content in skin's outermost layer drops, things kind of get slowed down, backed up. That's how you get dry, heaped up skin cells. You know, this is more of an issue with certain skin conditions, but also crops up with age. So the improved water retention and improved barrier function outcomes of topical retinol are yet another way in which retinol improves the appearance of the skin, as well as improved skin function. So that's just a glimpse of some of what retinol does to your epidermis, the top part of your skin. But it also works in the deeper layers of the skin, the dermis. Now, when we talk about the dermis, what people often laser focus in on is collagen. Loss of collagen as it relates to age and lifestyle factors, sun exposure, is what underlies wrinkle formation. One of the advantages of long-term consistent use of retinol is that it acts down there to allow for the fibroblast cells that live there to put out more healthy collagen. Not only does it do that, though, to help with collagen production, but it also suppresses enzymes that destroy collagen. And so when you go out in the sun, one of the things that happens with sun exposure is that sun exposure activates those collagen destroying enzymes. But retinol is there saying, no, we're not going to do that today. So not only does it stimulate new healthy collagen, but it helps to protect what you have. Now, of course, you need to be wearing sun protection along with it to really make sure you're getting these benefits, but that's really how it helps with the collagen health and the deeper layers of your skin. And the end result of that with consistent use is, well, you get an improvement in wrinkles. So it's not all BS. There's a true biologic change that happens in the deeper layers of the skin to smooth out wrinkles. But it doesn't just affect collagen production down there, it also affects blood vessel formation. It causes something called neovascularization. Basically, if you look at the skin when people get into their older years, especially where they have a lot of sun damage, you get a reduction in the number of healthy, functional blood vessels. Instead, what you see are these dilated, kind of bizarre appearing ectatic blood vessels. And with your eyes, what you see on the skin surface is something called telangiectasias, basically dilated blood vessels. I have a recent video, as a side note, on how to prevent those bad boys. Spoiler alert, one of the main ways is to protect your skin from the sun. But retinol can help stimulate healthy new blood vessel formation there. And that is beneficial for skin health because when you have a healthy amount of good functional blood vessels, they bring in nutrients, oxygen, growth factors, so that the skin has a better ability to heal, to recover from environmental aggressors that prematurely age the skin and aggravate underlying skin conditions. For people who use retinol, they will often appreciate what's called a rosy glow, and that reflects neovascularization. So while retinol can help improve the signs of skin aging by improving collagen production down there, it's not surprising that retinol is also therapeutic in the healing of wounds because of its effects on collagen, as well as on inflammatory markers, as well as on bringing in healthy blood vessel growth. Furthermore, its effects down in the dermis are also utilized in improving the appearance of stretch marks. Check out my video on what you can do about stretch marks. Retinol is one of the more evidence-based interventions for improving stretch mark appearance. All right, y'all, so that's the Cliff Notes version of what retinol does to your skin. So at this point, you might be asking yourself, well, geez, what can't it do? So while retinol is used to treat numerous skin conditions with a good track record for benefiting numerous skin conditions, not just acne, not just the signs of aging. I mean, it's one of the go-tos to treat a wide array of things. I do understand and agree with some of the skepticism around overhyping retinol, especially, those hyperbolic statements along the lines of you must use a retinol in your skincare routine. Topical retinol, including the cosmetic stuff, can have side effects, right? Especially it can be irritating. Some people do not tolerate it. So I'm not such a fan of telling everybody in a blanket fashion that they must use a retinol because truthfully, it's just not going to be right for everyone. And to make it seem as though they are somehow missing out or doing something that is less than ideal for skin health, for skin longevity, definitely sends the wrong message. Not to mention, there's a lot of heavy marketing, especially over on TikTok, of retinols to teens and tweens. But that being said, teens and tweens, as a reminder, they were the first group of people to be using retinol on their skin for the treatment of acne. It wasn't until 10 years after the fact of treating teens and tweens with acne that we came to realize, hey, it has anti-aging benefits. So it's not as though these ingredients are harmful per se to that demographic, but rather one should have pause because to be filling their heads with this concept of being terrified of wrinkles and having to prevent wrinkles, especially, they're a lot more impressionable, vulnerable, and it can really, in my mind, I worry at least, have a serious negative impact on their mental health, on their self-esteem, to be overemphasizing superficial appearance-based metrics. The best skincare habit, especially for young people to be getting into to keep their skin healthy long-term, as well as prevent premature skin aging, is focusing on sun protection. It really can pay off dividends in the long run. Now, recently I did a video discussing my thoughts on this new emerging trend of teens and tweens getting really into over-the-top, multi-step skincare routines with all these anti-aging ingredients. So make sure you check that video out. I'll link it down below in the description box. All that to say, retinol, it's not going to be right for everyone. So to say it's a must-have, no. While many dermatologists, myself included, use retinol in their personal skincare routine, I know many who do not. They're too busy, they're not motivated to use it, they don't have any underlying skin problem, and it's just not something that they use, or again, it's just not right for them. I don't know any dermatologist, and I know a lot. I know a lot. It's a small specialty. I know a lot, not just here in the US, but internationally. I don't know any dermatologists who don't make at least some effort to protect their skin from the sun, whether it's, of course, wearing sunscreen, sun protective clothing. I don't know, honestly, I don't know a single dermatologist who does not do something to protect their skin from the sun. And the majority of what dermatology as a specialty is seeing on a day-to-day basis in terms of skin problems are skin problems related to not protecting one's skin from the sun early on, getting excessive sun exposure. Not skin problems due to not using retinol early on in life. So keep that in mind. Skin problems, they don't arise because you didn't use retinol. Skin problems do arise because you got too much unprotected sun exposure throughout your lifetime, which set the stage for damage, various and sundry skin problems like skin cancer. So the most important proactive thing anyone can do, the must have, the must do, I'll use the hyperbolic language myself, is taking steps to protect your skin from the sun. That's what's going to pay off dividends, not only for skin aging, for skin cancer prevention, but also for those of you who deal with hyperpigmentation, sun protection is a must. For those of you who deal with rosacea, UV rays are a major trigger. All right, I hope this video was useful to you guys in terms of more insights into the biology of what retinol does for your skin. Now, for more nitty-gritty details on the different prescription retinoids, on retinols, how to incorporate them, skincare routine with retinol, definitely check out my playlist called Retinol Q&A. I have a ton of videos in there, lots of information, so check it out. But I hope you guys enjoyed this one. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.